Hi, my name's Gilly Davey. I'm a senior neurological physiotherapist and the clinical educator at the Advanced Rehab Centre. I'd like to take this opportunity to talk to you about multiple sclerosis and exercise and what's the current evidence available. So firstly, it's really important to know that the population of people with MS is that it's one of the most inactive neurological populations. So research has been done that there's a lot of people out there with multiple sclerosis who are not participating in hardly any physical activity, and that's just generally trying to keep them fit and active. They are taking about half the average steps per day, so someone who is normal and active would be aiming for about 10,000 steps a day, and someone with MS is generally walking about 5,000 steps a day. Unfortunately, what happens with this lack of physical activity is that you get into this awful cycle of deconditioning and the worsening of the disease, that the less fit you are, you try and do something and it feels hard work and it brings on some of your symptoms of fatigue, and then you want to do less and you just end up in a bit of a downward spiral. Of interest, there's also really high dropout rates and low maintenance of activity. So a lot of people with MS will start something, or they know they need to get into something regarding exercise, but often they'll start it and either drop out, or they'll do it for a couple of months and then one thing or another comes up and they just stop being that active in the long term. The concern with this is that there's a real risk of secondary complications, when we're looking at cardiac issues, the risk of strokes, heart attacks, diabetes. All this comes in line with leading an inactive lifestyle. So the question is, why? Why are people with MS so inactive? One main thing is this really feeling tired and, fatigue, and I'll discuss a little bit more about fatigue and how it affects you in the next slide. When the majority of people are diagnosed with MS symptoms, their presentation can often be mild, so often referrals to a neurological physiotherapist or a proactive approach of keeping activities levels up is not pushed at the moment. So this is why it's really important that if you are newly diagnosed and you haven't been to see a neurological physio who is an expert in getting you active and participating, this is the time to go. Also, if you've had your MS for years and you still haven't seen someone, it's best to be proactive, come along and see a neurological physiotherapist who is going to be the expert at working out what activity is going to be good for you. A lot of people feel like they're kind of fighting a losing battle. However, the more physically active, fit and strong you are, you're going to have a better quality of life, okay? And it's all about the now. You're living in the now, so let's go for a real good quality of life, making the most of it. Some people really struggle in the heat, especially living in a warmer climate like here in Australia where we have some really hot days. It can be really hard to motivate yourself to do an activity if you are really struggling in the heat. However, there's some fantastic research out there about the evidence of pre-cooling and trying to manage that heat intolerance. And again, that will be discussed later on in this presentation. There used to be a theory that exercise can cause a relapse, okay? Now this is incorrect, okay? There has been no published research studies that report any adverse effects of exercise or physical activity on MS. Okay, so it's really important to understand that exercise will not cause a relapse. It may increase a little bit of your symptom presentation for 1 to 2 hours post-exercise, but that symptom presentation will resolve, okay? So it's really important to understand that. Unfortunately, if you've had a negative experience of doing an activity or doing an exercise, that will really hinder your appreciation of, how more active you need to be. So we want to make sure that you have a really positive experience, that you don't walk out of the clinic feeling awful, that you walk out feeling energized, feeling like you've worked hard, but that you're out there achieving a positive change. It's also very difficult for people who have never been interested in exercise. If you've never been one to exercise, you've just gone to work, done your thing, and then all of a sudden, you've been diagnosed with MS, and, people are saying to you, you must get fit, must get healthy. This is your time to lead that positive change, to be the healthiest person you can be, okay? Everyone knows that physical activity and exercise is a key component of leading a healthy life, okay, and a good high quality life. So if you've not been interested in exercise and you're not quite sure where to start, this could be the program for you. So fatigue, okay, fatigue is one of the most self-reported features of MS, okay. It can be a primary symptom. However, it's really important to understand it is often a secondary symptom. And when we mean a secondary symptom, this is due to experiencing other symptoms like pain, spasms, disturbed sleep, medication. All of these, okay, will have an effect on your tiredness level. And also importantly, the less active you are, the less that your body wants to do. So if you are very unfit, if you want to walk up to the shops, it's going to tire you out and make you feel fatigued. Okay, but however, if you get yourself strong and fit, that walk up to the shops isn't going to be tiring you out. Okay. If fatigue is an issue, you need to ensure that you are using a structured fatigue management plan, okay, and understand about pacing. Okay, if you're unsure about how to do one of these, again, this is a perfect time to be coming in and either seeing a specialist physiotherapist or occupational therapist who can put you through a management plan so that you can be, again, achieving the things you want to achieve without wearing yourself out. Okay. Of interest, there is exercise can significantly reduce fatigue. There has been several studies, okay, and some great analysts of, groups of studies saying that exercise is associated with a significant reduction in fatigue, okay, and this has been seen in all sorts of different exercise, including hydrotherapy. And again, as I mentioned on the slide before, there's no exercise study that has shown an increase in fatigue. Okay, if you are being treated by someone who has got good knowledge, okay, with treating people with MS, then they can put you through a structured exercise program that will bring your fitness levels up under control so that fatigue symptoms won't increase. So it's an exciting time in rehab. More and more evidence is being published about the benefit of exercise and MS. The first research was published in 1984, and now we're up to well over 1,000 published articles just on exercise and MS. As the years go on and more research is being done, over last year, 120 articles were published about exercise and MS, and 93 have already been published in the last 6 months. Strong evidence that randomized controlled trials are supporting exercise therapy compared to no exercise. And as you see, there's a big list here that there is evidence out there to show that exercise can help improve your balance, your quality of life, your walking, functional tasks, so those simple tasks helping around the house, cleaning, making yourself a meal, getting to work, doing the jobs at work. It can help with your spasticity, your fatigue, your strength, cardiovascular fitness. We're going to talk a little bit more about pain and the difference about that neuropathic pain that people with MS can experience. What's really exciting is the bottom two, okay, that exercise can help improve the cognitive function and also has the potential to help with that disease progression, okay, due to the anti-inflammatory nature that exercise can have on the body. And again, we'll be talking about that in this talk. So firstly, with strength, okay, what's really interesting is that people with MS However, muscle activation can be reduced by up to 50% compared to a normal person. Okay, so this is where it's really important that we work on some strength training. Okay, because this reduced muscle activation means that you've got less motor units within your muscles firing to cause a contraction. Okay, and that contraction in the muscles, what's going to give you the strength to then move. Okay. There's been significant evidence to show that strength training can improve your function, your strength, and your neural drive. Okay, so what we're unsure of still in the medical world is how we can strengthen a partially innervated muscle. So if you have had nerve damage to some of your muscles, do we know if we can strengthen that? We're not sure. But what's really interesting is this neural drive. With progressive resistance strength training, it's been shown that that neural drive can improve. Now what that means that if you are recruiting the muscles you've got faster, okay, and more effectively, you're going to feel stronger, okay, and there's going to be less cognitive strain on your brain and that central fatigue from trying to initiate weaker muscles to work. Okay, so there's been lots of research showing that about 2 times a week of strength training, and it has to be a progressive strength training, can really help. Cardiovascular exercise is one of my loves. As I say, the MS population are renowned for being very inactive, and unfortunately that puts them at huge risks of heart disease, diabetes, strokes, respiratory infections, having issues with bladder, bowel, skin conditions. Exercise can be of benefit to all of these sedentary lifestyle effects, and that's why it's really important to keep yourself fit and active. However, what's really important as well is that they found, where research has been coming out in the last 5 to 8 years, is that the protective effect from cardiovascular fitness on brain function and structure. Okay, and we're going to talk about that more in the next slide. This is a really exciting time to be involved in neurological rehabilitation, because more and more evidence is coming out regarding looking after the brain, cognitive health, and the potential to slow some of the progressive conditions down out there. Now, we are not guaranteeing anything. Unfortunately, there is still no cure for MS, and we cannot guarantee that we're going to have an effect on the progression of your condition. However, exercise has been shown to reduce the symptom presentation. It's important to understand that MS is an inflammatory condition, which means that inflammation markers are being released in the body associated with the plaques on the central nervous system. However, exercise is anti-inflammatory. So exercise has a real effect at reducing those inflammation markers. There's been some great research out there that's shown that people who have exercised on a regular basis for 6 months have reduced their inflammation markers significantly within their blood counts, and this has been represented by significant reductions in their symptom presentation from their MS. What's a really exciting part of research that's been coming out and being pushed a lot more in the last 5 years or so is that when you work vigorously hard, and we're talking about getting out of breath, we're talking about sweating, okay, actually making your body work physically hard, that is when you release all these great hormones and neurotrophic factors into your blood system that go into the brain and increase the synaptic activity in your brain. And there's been research in many different neurological fields, including the normal population, that it's exercise that can enhance this cognitive function and keep that good blood supply going to your brain. So basically, it's not underestimating the effect of exercise as medicine. A lot of people out there, including yourself, you may be taking medicine to help you feel better. Are you taking that medicine to try and slow down the progression of your MS? Are you trying to take that medicine to help with your symptom presentation with your MS? Well, here I am talking about the research that says that exercise has the benefit of reducing symptom presentation. And exercise, it's free, it's out there, and it's got no side effects. So this is the time is to be really pushing for that exercise and using it as a medicine for your health. So going on with that feeling better regarding mental health, up to 60% of people with MS will suffer full or partial post-traumatic stress disorder or major depressive disorders. Any form of stress, anxiety, depression will or have been associated with an increase in your symptom presentation. If you are not feeling good because you are really stressed or you are feeling very low, your symptom presentation will be more because it's an increase in those inflammatory markers in your body. What we know again with exercise, exercise is one of the best things to help reduce stress, anxiety, and depression. There is cognitive impairments can occur in up to about 50% of the MS population. And again, we're going to really advocate that exercise enhances that cognitive function. So if you've noticed that you're starting to forget things, or you're just finding processing some complex sums at work is becoming difficult, make sure that you're doing some exercise to get that active blood supply to the brain to help with that connectivity in there. Now, pain, about 50% of people with MS will complain of pain at some time. Now, it's important to understand there's two types of pain. There's the nociceptive, which is your normal pain. So that's when you've fallen over and you might have sprained your wrist and your wrist is swollen up, and it's having an inflammation, and we will be recommending that you use your ice to help get the swelling down. You might have some anti-inflammatories to help manage that pain. There's also the biomechanical changes, so that if you have a bit of foot drop and you're struggling to clear your foot off the ground when you're walking and you're getting tired, that what you're going to start doing is start hitching up your hip to help clear the ground, and then you're probably going to end up with a bit of back pain because you're overusing an area and straining it. So it's these biomechanical changes that is again really important that you see a neurological physio to help you with, to try and keep your body as strong and as pain-free as we can. There's also the neuropathic pain, which is this radiating nerve pain. It can often feel burning and stabbing or pins and needles. There's been lots of evidence out there showing that exercise and regular movement, including hydrotherapy, can really help manage this nerve pain. They reckon with neuropathic pain that you cannot remove it, you cannot take it away, but you can hopefully dampen it down, which means that it will be less inhibiting for you. I want to just touch on the vestibular function. Now, you may not be aware the vestibular system is your inner ear balance. Now, unfortunately, there is a high percentage of people with MS that will have some form of plaque affecting the nerves around that vestibular system around the inner ear. Now, what this can cause is issues with your balance. So it's important that if you are finding any issues with dizziness, that you're feeling unbalanced, that you do have this looked at by either a neurological physiotherapist or by a vestibular physiotherapist that can give you some quite simple exercises to help strengthen the neurological response and the strength of the muscles within the eye, with that gaze stability that can have quite an effect on your ability to balance. So I just wanted to touch base on that, so that it is an expected symptom to be unbalanced and feel dizzy, but we can help that feel better. Now, I just wanted to touch that there has been published guidelines last year about how much exercise to do. So I've been talking a lot and really pushing the fact that exercise is vital and really important, but how much should you be doing? The guidelines are recommending that you are doing some form of physical activity 4 times a week. So that's 2 aerobic activities and 2 strength training activities. It's important though, if you're considering about getting into physical activity and exercise, about what you do. Okay, everyone is very individual with their likes and dislikes, and it's often looking at what are your barriers of getting into exercise. Is it, do you need to make sure something's close to you so you don't need to worry about driving there and getting tired? Are you working full time and have a family, and do you need to work it around your lifestyle that you currently have? Is it to do with costs? Is it, one really important thing is making it fun, because if exercise or activity is fun, then you got to do it longer. This is the big thing we mentioned there. A lot of people with MS that do some form of activity unfortunately drop out, and we want to make you active for the rest of your life, okay, giving you that quality of life. So this is when you might need to see a therapist who can give you that personalized approach and work out what's the best approach with you. Is it a group activity? Is it doing something one-on-one? Is it you setting you up with a gym program for your local gym? Is it a walking program that you can do from your house? We are the experts in exercise, and we can find something that will hopefully suit you. Now, heat sensitivity can affect a huge amount of the population with MS. However, it doesn't affect everyone, and it's remembering that the symptom presentation of your MS can be very different from person to person. However, when you do overheat, you may experience difficulties with balance, weakness, fatigue. You might get some double vision. You might get pins and needles. However, when you cool back down, that kind of increase in your symptom presentation should resolve within 30 minutes to 2 hours, okay? It's all to do with basically the nerve impulse just becoming slow or blocked along the nerves because of the heat, okay? If it does not settle after 2 hours, then probably the intensity of the exercise you worked at, or the situation you were in, which was very hot, was probably for too long. So it's being mindful of trying to keep yourself cool. And now we're going to go and talk on about some pre-cooling. Pre-cooling is an exciting area of research showing that the symptom presentation, especially with the overheating, can be significantly reduced by pre-cooling. Okay, and now you can achieve this easily by keeping a couple of drink bottles in the freezer and then taking them out in the morning, so you're constantly drinking nice cold liquids through the day. If you know you're going to be out in the car, you're going shopping, and it's a 35-degree outside, then make sure you're taking on lots of cold liquids. They've talked about sucking ice cubes as well. A cool bath or a cool shower. I encourage all my clients with MS to have a cool shower before getting into the hydro pool. You might do this before going to the gym as well, just to reduce that body temperature to help you work. Another good tip is to either dip your sports sweatbands in cold water, or even put them in the freezer and then put them on, because that cold water around your wrists or around the top of the head again is really good at reducing your core temperature. You may find if you're in a very hot environment, and that's where you live, that something like a cooling garment, you can get these body vests as demonstrated by the cyclist here in this picture, that are really good at, again, pre-cooling you down. Now I just want to talk a little bit about our very exciting MS Get a Head Start 6-week hydrotherapy program. What has been shown with hydrotherapy, that it is a better conductor of heat than air, the water is, so the likelihood of overheating and getting some of this heat sensitivity symptoms is actually reduced in hydrotherapy, which is quite different for what common belief was, that a lot of people have got concerns with MS about going into a hydrotherapy pool that they will overheat. Okay, if the hydrotherapy pool is run at the thermal neutral temperature, which is 32 to 34 degrees, then it is a better conductor of heat, and you're more likely to maintain a constant body temperature. As I always encourage our clients to either have a cold shower before, and always to have cold water on the side of the pool as well. Now the program is a really exciting program about trying to educate and empower people with MS of how to exercise for themselves. Though it's a group program, you will be treated as an individual. It's really looked at trying to motivate you to get you back into activity, or make sure you're doing the right activity for yourself and your MS. We really believe that knowledge is power. The more you know about MS and the more you know about exercise, is you can link these together and be able to treat yourself. Okay, it's really about designing of getting you up, getting you going, and then from there you can be leading that physical active lifestyle and just touching base. It's a 1 hour session twice a week, okay, and it's looking at really educating you on the principles of exercise for MS, that fatigue management we touched on earlier, how to manage that pain, especially if you've got neuropathic pain. We've talked about the importance of the detrimental effect that stress and depression can have on your symptoms. So we talk about, how you can help manage some of that and the cognitive processing. We also spend time educating you on all the other services available, looking at clinical psychologists, neurological orthotists, acupuncturists, occupational therapists, masseuse, and all those things that can be of benefit for your MS. The where to from here, what we don't want is you do the 6 weeks and then stop exercising. It's very much pushed about giving you that incentive, that intuition to take on from this program and carry on doing regular exercise. So when to get in touch? If you have MS or you know someone that has MS, the best time to get in touch is right at the start, newly diagnosed. We want to see you then before issues arise so that we can get you exercise, active, and doing all the right things from the get-go. However, if you've had your MS for years, that's absolutely fine. We still want to see you if there's been a change of medication after a relapse, or just simply if you're not currently active and you're not quite sure what's the best to do with you. And it doesn't matter if you're walking and running and still competing in half marathons, or you're in a wheelchair and just getting A to B. There is somewhere to start, and the best place is to start. So just to conclude, what I'd like to say, that exercise is vital to be leading a fit, active, good quality of life. When should you be starting? Now. And don't underestimate the effects of exercise as medicine. And why not give us a call and come and try our new innovative 6-week hydrotherapy program, the MS Get a Head Start. Thank you very much for your time for listening, and I hope you found this talk of interest. If we can be of any more help, then please contact the Advanced Rehab Centre, and we look forward to hearing from you.